Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about microtomy, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss rationale and aims, learning outcomes, indicative content, resources, submission of evidence, Q&A ideas, evidence ideas, reflective statement, and some helpful tips to make candidates' portfolio better. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into this submodule. Rationale and aims of this submodule outline the general information and expected knowledge and competence that candidate needs to achieve when this submodule is completed. These are relevant to each submodule. For this submodule, the expectations are that the candidate will be able to explain and demonstrate the processes employed during the production of high-quality tissue sections, suitable for routine staining, special stains, IHC, fish etc. Produce suitable sections from a variety of tissues. Use their knowledge and understanding to recognize and remedy common faults. Produce sections appropriate to the tissue and pathology under investigation, for example, appropriate section thickness, use of coated slides, taking unstained sections for later use. The learning outcomes demonstrate candidates' knowledge, skills, and competence in this submodule. They also include demonstration of the understanding of scientific principles, laboratory procedures, quality assurance, and professional conduct. They allow candidate to work autonomously and solve problems independently. The first learning outcome is explain the principles and practice of microtomy, and discuss the advantages and disadvantages of different types of microtomes for the production of tissue sections. Candidate needs to know about microtomy. Does the candidate know what are the principles and practice of microtomy? Do they know what are the advantages and disadvantages of different types of microtomes? Candidate could consider principles and practice of microtomy like support and rigidity, precision cutting, controlled thickness, optimal angle, trimming and sectioning, flotation, mounting, drying, ergonomics. Types of microtomes like rotary, sliding, rocking, vibrating, saw, ultramicrotome or cryostat. The second learning outcome is recognize the hazards associated with microtomes and explain the appropriate actions to maintain safe working, including steps to take in the event of an incident. Demonstrate setting up your personal workstation in an ergonomic manner. Candidate needs to know about hazards associated with microtomy and correct of working station. Does the candidate know what hazards are associated with microtomy? Do they know how to maintain safe working during microtomy? Do they know what actions to take in the event of an incident? Candidate could consider hazards like Sharp's injury, repetitive strain injury, tissue loss, health and safety risk solutions that can be used during microtomy for difficult blocks. Actions to minimize hazards like blade guard, ergonomic setting, break. Steps taken after incidents like informing first aiders, datixing the incident, communication, steps depend on the incident. Candidate also needs to be competent in setting up and using microtome. The third learning outcome is demonstrate the practice of section mounting, e.g. location and number of sections on slides with relation to underlying principles, and discuss the use of coated slides for different applications. Candidate needs to demonstrate section mounting. Does the candidate know what is section mounting and why is it performed? Do they know what are the key steps of section mounting? Do they know what mounting media to use? Do they know what is the difference between them? Do they know when to use each and why? Candidate could consider practical skills like types of slides and when to use them, optimal section position, number of sections on slide depending on the sample type or cutting protocols, need for control sections. Mounting media, SOPs, various cutting protocols, and their training and competency. Various mounting media like xylene-based for routine use such as Pertex, water-based for oil red O such as glycergel, or specialized anti-fade for if to prevent photobleaching. Candidate could provide specific examples from their practice and when they use each. The fourth learning outcome is, demonstrate with examples from practice good quality sections. Discuss the implications of poor quality sections and common causes for unsuitable sections and how to remedy them. Candidate needs to take good quality sections and discuss implications of poor quality sections. Does the candidate know how to obtain good quality section? Do they know what are the causes of poor section quality? Do they know how to remedy problems? Candidate could consider their cutting technique, microtome setup, blade type and sharpness, use of reagents to help with problematic blocks, water bath setup, following SOPs. Problems like chatter, scores, creases, tissue lifting, not full face, folds, squams, carryover, implications of those problems for service users. Preventive measures and remedies to various problems. The fifth learning outcome is, discuss the histological significance and impact on patients of sections which inappropriately demonstrate the area of interest, e.g. full face. Candidate needs to know about significance of poor sections. Does the candidate know what is the significance of section not obtained at full face? Know the implications of poor sections on the patient? Do they know the importance of exposing the area of interest for reporting? Candidate could consider incomplete diagnostic features, poor sample representation, need for further work, delay in reporting that can cause further stress to the patient, relevant features missing, potential for misdiagnosis leading to incorrect treatment or patient management. The sixth learning outcome is, explain the clinical rationale underpinning the examination of multiple levels. Candidate needs to know about examination of multiple levels. Does the candidate know why would some samples require multiple levels for assessment? Do they know the reasons for samples requiring multiple levels? Kate could consider better tissue representation, confirm diagnosis, detect hidden features, detect focally distributed abnormalities, assess the whole lesion, to rule out various conditions, to reduce sampling bias, when the initial findings are ambiguous, to assess severity and extent, to minimize diagnostic error. The seventh learning outcome is, demonstrate appropriate orientation of tissues at embedding to identify the necessary histological features for diagnosis, and discuss the impact and importance of appropriate block and tissue orientation for microtomy. Candidate needs to orientate tissue correctly and identify relevant features. Does candidate know what tissues need to be orientated during embedding and why? Can they identify relevant tissue features? Do they know the impacts of poor orientation on microtomy and sample reporting? Can they orientate various tissues during embedding correctly? Candidate could consider orientation of skin, tubular samples, organs, bisected and inked samples, samples with very specific orientation needs like alopecia or temporal artery samples, various tissue features that need to be demonstrated by correct orientation, presence of margins. They could consider the importance and impact of tissue orientation for microtomy, sample reporting and patient management. The eighth learning outcome is, demonstrate troubleshooting of microtomy problems which may arise, include root cause analysis as appropriate. Candidate needs to troubleshoot microtomy problems. Does the candidate know what are the common problems associated with microtomy? Do they know how to resolve them? Do they know how to perform root cause analysis? Candidate could consider various problems like chatter, scores, creases, tissue lifting, thick-thin cutting, not full face, folds, squams, carryover. Troubleshooting steps they would take to resolve the issues like problem identification, root cause analysis, corrective and preventive ends, monitoring, documentation, and so on. Indicative content highlights background knowledge that might be assessed during the viva. They may or may not be demonstrated by the learning outcomes or candidate's evidence. In this submodule, candidate is expected to have the knowledge and understanding relevant to different types of microtomes, how and when they might be used, rotary, sledge, or rocker. How different tissue types may need different approaches, lymph node, fatty tissue, suspected amyloid samples. Standard sets of special investigations. Cutting multiple sections for medical liver or renal biopsies. Indicative content also highlights skills and competence the candidate is expected to be able to do. For this submodule, candidate must be able to select the correct slides for different samples, coded or charged slides for special investigations. Recognize and correct common artifacts, scores, chatters, thick and thin. Follow standard operating procedures for levels, serials, section coils, curls, and step sections appropriately to cut a range of tissue sections to the required standard, maintaining appropriate audit trail records. Resources section on the Brightspace contains some very useful information for this submodule. Submission of evidence section on Brightspace informs the candidate what evidence needs to be submitted for each subsection. Candidate needs to submit answers to questions that were set by the training officer. I will share some examples of possible question suggestions later on. Candidate also needs to select an additional piece of evidence relevant to this submodule. For evidence ideas, please have a look at the video for trainee. Each submodule also requires the candidate to submit their reflective statement relevant to their practice and training in each submodule. These are some example questions you could give your candidate to test their knowledge, competence, and skills about this submodule. These should be based around the learning outcomes mentioned earlier. These are some more example questions you could use for this submodule. You could ask them to complete tables you created based on the learning outcomes. Or you could use images to test candidates' knowledge and competence. Supporting evidence should be selected by the candidate. It needs to be based around the learning outcomes and indicative content, and be relevant for each submodule. The evidence should allow the candidate to demonstrate their specialist knowledge and competence in each submodule. It should be specific and relevant to the candidate's in-house practice. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Each submodule also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each submodule. How do they demonstrate that they can draw a conclusion from what they have learned, reflect on their current practice and how it can change in the future due to gained knowledge? They could think about what is their lab role in context of this submodule. What impacts can their actions have on their colleagues, department as a whole and for the patients? They also need to write a personal reflection on their training in the lab and explain why they chose their evidence. This is very personal to their own circumstance. It should demonstrate their ability to be self-aware when analyzing gaps in their knowledge. They can use it as an opportunity to reflect on aspects of their training, application of their gained knowledge and skills, and how they have achieved their goals. They should think about what their evidence demonstrates, and why they chose this specific evidence for this submodule. Also, they should write about what their training was like when it comes to this submodule and how their practice changed due to their training. Their reflective statements can also be used as a CPD evidence in case they are chosen to be audited by the HCPC. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, animations, pictures, posters, flowcharts, videos, photographs, PowerPoints, diagrams, graphs, infographics, charts. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like a case study, for each submodule. They could use experiments, case studies, annotated results, troubleshooting, controls production, annotated images, risk assessments, glossary, training presentation, certificates with reflective statements, nonconformances, validations, verifications, comparisons, ECHA results, annotated audits, kappa or DATIX, Q&A. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If they like experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the learning outcomes and indicative content in mind when they are selecting their evidence. Learning outcomes that require the candidate to demonstrate something would be ideal for covering with their evidence. And this brings me to the end of today's video. Hopefully you now have a better understanding about the learning requirements for this submodule. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those learning outcomes in mind when selecting questions and guiding the candidate. Bye for now.